right, so let's talk about CNAs. So I came up with this mnemonic: CNAs cannot eat. So CNAs cannot evaluate, assess, nor teach. So your CNA, their job is just going to be to do routine things like ambulation, transfers, feeding the patient, hygiene, but we want to make sure that they're doing that on stable patients, okay? But a CNA cannot evaluate. A CNA cannot evaluate. Let's say, this is a good example. Let's say that you gave a patient a blood pressure medicine because the blood pressure was super high. The CNA cannot evaluate to say like, okay, I rechecked their blood pressure and their blood pressure came down. A CNA cannot evaluate, okay? Even though they can collect the data for the nurse to evaluate, but the CNA cannot evaluate. The CNA cannot assess. A CNA cannot assess. So another good example, like if you're washing, the CNA is washing the patient and they find a pressure also on the patient, the CNA then can't go in there and document actually what they saw and all that kind of stuff. That's called assessing, right? So what the CNA would have to do, they would have to go call the RN, and then the RN would then be able to assess the wound. A CNA cannot teach. You guys, this is a big one because if you are a CNA, you work in the facilities, you see that CNAs actually do a lot of teaching, but they cannot in the NCLEX world. So let's say that your CNA may tell the patient, hey, you need to get off your bottom. You need to rotate from side to side to prevent you from getting a pressure ulcer. You guys, that is teaching. Your CNA cannot teach. So I'm telling you, it is so important that you detach yourself from the real world and NCLEX world. So in the NCLEX world, the CNAs cannot evaluate, assess, nor teach. And also one thing that can help you when it comes to delegating to a CNA, we don't want to think that we're delegating to a CNA who has been a CNA for 15 to 20 years. That is super experienced, and that could really run circles around RNs, right? We don't want to think about them like that. We want to think about those CNAs that took a 4 to 6 week class. That's how we want to look at it, okay?